Yes. Good evening, all. Welcome to this session. It's a very pleasant evening. I hope you're all preparing for your NORCET 9 in a very versatile manner. Okay. Let me check, dears. Please confirm that is my voice is audible or not. Yes, the video is visible. Yes. Okay. Okay. Today we are going to see one important topic, which is a very basic topic you might be knowing, but we have to reinforce ourselves, right? It's a basic topic, but everyone asked in the last week also. So I came up with the topic. Can anyone guess which topic we are going to discuss today about OBG nursing? Yes. Okay, thank you. Come on, anyone? It is menstrual cycle. Related to that, we are going to see the MCQs because we can expect some hormonal changes questions and reasoning and assertion question also we can expect, right? So that I have came up with you all people. So tell me, what is menstrual cycle? A menstrual cycle is a normal physiology where the woman is experiencing in a cyclic manner, where the ovarian and uterine changes is happening in a cyclic manner every 28 days. If it persists more than again proceeds. If the pregnancy is happen, no menstrual cycle is going to happen. Okay? Yes. 5 days we can call. If it's more than 35 days, we are calling it as abnormal menstrual cycle. Okay, what is menarche? Before that, you are going to tell about the puberty. Yes, puberty. And what are the sign? Is telage. Okay, first not visible sign is growth spurt. First visible sign is telage. Okay. For telage, which hormone is responsible? For telage is estrogen. Okay, anyone? Yes. For puberage is androgen. Okay. For puberage is androgens. Okay. So this is the sequence of puberty here. So the first onset of menstrual period is called menarche. Okay. What is menopause here? Menopause is cessation of menses. The woman after 45 years, or the average age, mean age is 47. Globally we can say it is 51 years. If there is no menstrual cycle, we are calling it as menopause. Okay. Yes. Is it clear? Yes. So average of 28 days the menstrual cycle is. Okay. First 1 to 14 days we are calling it as pre-ovulatory phase. Okay. Second, that is from the 15th day to 28 days. This 14th day is called as ovulation, where the ovulation is going to happen. From 15th to 28 days, we are calling it as post-ovulatory phase. And secretory phase. The follicles are developed and the dominant follicle is happening, proliferation is happening and giving a way for ovulation. After ovulation, it segregates the ovulation by the luteal and secretory phase. Again the cyclic change is going to happen. Okay, it is an outline and overview. Let me discuss what are the changes happening and the hormone is responsible for how the hormones are produced. Okay, in the next slide. Okay, this is the fun. First 1 to 5 days, that is menstruation is going to happen. After this, menstruation is going to happen. Okay? Yes. Is it clear? First 1 to 5 days, menstruation, that is the bleeding phase, is going to happen. The endometrial layer sheds. Endometrial layer sheds. Endometrial layer sheds, and from the basal layer is going to develop. Development is going to happen. It may be 1 to 8 days also. I am waiting for your comment. Yes, it is clear now. Come on, tell. We are going to wind up. Okay? Yes. 50 to 60 ml. I need a precise answer. Yes, you are close. It is up to, we can say 50 to 80 ml is the correct answer. This is the old guidelines. New guidelines, what they are telling is 5 to 80 ml. Consider one hormone. If the woman attains the puberty, what is going to happen there? If the pituitary gland. If the girl attain puberty, then this hormone GnRH, gonadotropin releasing hormone, will be released. Normally, we all human beings have this gonadotropin releasing hormone will be in the normal amount. From this follicles are going to be started. What is a follicle? What is a follicle? Follicle is a pouch-like structure which carries immature eggs. Immature egg is, we are naming it as oocyte. Yes. Come on. Is it clear for you all? The audio is not clear? The audio is not clear? The audio is clear now? Yes, okay, done. So follicles is a oocyte. Okay, we naming it as oocyte. So after that, what is going to happen? The oocytes are developed. Oocyte will be having, this is the oocyte. Okay, this is the granulosa cells. Cells. And this is the outer layer is theca cells. This theca cells will produce one hormone. This is happening in first 1 to 14 days. After the menstruation, the endometrial layer sheds. After that, from the basal layer, it regenerates, and the oocyte is again forming. That is, I am explaining now. Okay? Yes. Theca cells will produce an hormone called androgen or androstenedione. Androstenedione. So what will happen? Then again these granulosa cells act on the FSH hormone FSH and LH will produce aromatase. This aromatase will convert this androstenedione to estrogen. Okay, so that estrogen is formed. Okay, from which cells it is formed? From this granulosa cells. Theca cells will produce this from the LH, luteinizing hormone. Okay, yes. Is it clear? Okay. So 14 days is over. From the 14 days, what is going to happen? After that, this, the help of this estrogen, okay, FSH, LH and is estrogen, one dominant follicle is formed. The other follicles, more than 20 follicles will be there, one dominant follicle. See, again this estrogen and progesterone will have negative feedback given by the inhibin hormone. The endometrial layer sheds. Okay, then again cycle is going to happen. Okay, now coming on to this diagram. Okay, coming on to this diagram. Okay, see, I have told you that this ovarian cycle is happening in a cyclic manner. Ovarian changes are there and uterine changes are there. Ovarian changes will have the follicular development and the sheds happen, and in uterine changes what is happening? Only shedding of endometrium and regeneration is going to happen. That is the difference you have to note. So this is the endometrial layer. So what are the hormone will be at peak level? Now we are going to see that. Okay, this estrogen and progesterone is one of the important hormone, this ovarian hormone. What are the pituitary hormones? Is follicular stimulating hormone and LH using in the next slide. Okay, follicular phase, that is first 1 to 14 days. After, from the 15 to 28 days, it is we are calling it as luteal phase, and secretory phase we are calling it as from the day 24 to day 28. The endometrial layer, this estrogen and progesterone will be get reduced. Corpus luteum, I have told you, no, corpus luteum will be turned into corpus albicans. The endometrial layer sheds. Okay, endometrial layer, kindly check your connectivity. I am checking the audio, it's clear. Okay. Yes, okay. Endometrial layer sheds. Okay. Kindly check your connectivity. Okay. Coming on to this duration. Okay, already I have told for the menstrual phase. Now we are going to see about the key features. Now I have explained the physiology, what is exactly happening in each phase. I will give giving some summary of that. Okay, from 1 to 7 days or 1 to 5 days menstrual phase is going to happen. After that, from 1 to 14 days the endometrial layer sheds, and again basal layer is going to regenerate. Follicular development is going to happen. Which hormone is responsible? That is gonadotropin releasing hormone will act to release this follicular stimulating hormone and LH hormone. After that, the follicles are going to develop. What is follicle? Follicle is nothing but it is the oocyte, which is the immature egg. It is going to happen from primary oocyte to secondary oocyte. Okay, it is going to develop. So which hormone is going to play important role there? This follicular stimulating hormone and LH hormone. This endometrial estrogen is secreted, the follicles are developed, dominant follicle releases the egg in the day of 14, that is ovulation day. After that, corpus luteum, the remaining follicles, these estrogen act as a negative feedback to tell this pituitary, that is hypothalamus, to decrease the secretion of follicular stimulating hormone, so that the remaining follicles, 20 to 30 follicles are there, one dominant follicle is developed, other follicles will shed down and forms into corpus luteum. This corpus luteum will secrete the progesterone hormone. This progesterone hormone will act as a luteinization which is taking place, luteinization and also the secretory phase. This layer is going to shed, and again it is going to have a cyclic formation. This is the physiology here. Now we are going to see about the physiological and hormonal changes with high impact. Okay, where the MCQ can you will be asked. Okay, yes. The menstrual phase is 1 to 5 days. It may extend up to 7 days. What is the follicular and proliferative phase? Already I have told it is 1 to 14 days. Okay. Early follicular recruitment is going to happen. So after that, the shedding is happened. During this phase, estrogen progesterone will be increased or decreased? That is my question. Yes, just a minute, hold on a second. Yes, now it's audible. Now it is audible. The video is good. Yes, it will decrease. So come on, what will be happening? Already I told key features: bleeding and endometrial sludging, that is shedding of the endometrial layer. Okay, what is happening in the follicular phase? So multiple follicles are developed. Already I told 20 follicles, for example, it is developed. Only one dominant follicle is going to develop there. It is going to form as a egg. Okay, developed dominant follicle. Only one is going to develop. What is happening in the endometrial layer? Endometrial regeneration and proliferation is going to happen. So obviously this estrogen and follicular stimulating hormone will be increased or decreased. Okay. So where we have left? So this is the point we have left. Yes. Come on. Early follicular recruitment. First phase, what is going to happen? This estrogen and progesterone will be getting reduced. Okay. Coming on to the follicular phase, that is proliferative phase. What is going to happen from 1 to 14 days? Where the follicles are going to develop, only one dominant follicles is going to develop there. Okay. This endometrial regeneration and proliferation, what is going to happen? It will act on this FSH, that is follicular stimulating hormone, and estrogen, which is going to decrease or increase. So obviously it will increase. What is going to happen? The endometrial lining thickness, cervical mucus thickness, it is going to develop and it will become thin and stretchy. That's what it is happening there. Okay. Yes. Again, coming on to the ovulatory phase. Already I have told the mid of the cycle, that is day 14, 14th day is called as ovulatory phase. Only one day. It is easy to remember, right? Yes. This mature follicle going to rupture and oocyte is released. Yes. The endometrial gland is elongating. What is happening there? This FSH, that is follicular stimulating hormone and luteinizing hormone surge is going to happen. Estrogen peaks, LH also going to peak. Only one hormone is going to peak from the pituitary, that is LH. Okay. FSH also will be increased. This mitral MERS is the pain experienced by the woman during the normal menstrual cycle. Okay. And the basal body temperature will be increased. At which phase the woman will be experiencing the basal body temperature will be increased? So why it is happening? This estrogen FSH will act on the thermoregulatory center. It triggers the thermoregulatory center, right, from this pituitary, that is hypothalamus, so that the basal body temperature is increased here. Okay. Yes. Coming up, is it clear now? No comments yet? Let me throw you a question. Which hormone is released in pulsatile manner and responsible for the menstrual cycle? Come on, you are going to tell the answer. The question is, which hormone is responsible for menstrual cycle, menstruation, will act from the pituitary gland? Come on. Anyone? Come on. So students, those who are preparing for your NORCET 9.0, NNL gives you a beautiful plan. It's a very effective plan for you all people who are studying for, who are preparing for NORCET 9.0 and 10.0, that is Plan C English edition, that is Platinum edition, where the Pan India faculties, mastermind faculties having a lot of lectures which will cover all the topics for the NORCET aspect. So hope you guys will make it as useful. You can explore the NNL one app once for your queries and doubts. Yes, anyone can tell which hormone is responsible? That is GnRH. Okay? Yes. That is GnRH. Yes. Coming on to this topic. Coming on to the luteal phase. Already 14 days is over. Now we are going to go for the 15th day. 15th to 28 days. Till now we have seen about the 14 days. Coming on to the 15 to 28 days. What is exactly happening? The days of 15 to 28, formation of the corpus luteum. Already I have told this corpus luteum is going to change at a corpus albicans. So it is happening in 24th to 28th day. Luteum again is going to degenerates. Obviously the menstrual endometrial layer sheds. Menstruation is going to, yes. Coming on to the key features. Why I am focusing on this? Why I have made a tabular column? Because from this they may ask you a question. So let me throw you a question from this itself. Okay, which is the ischemic phase, which is called the premenstrual phase. If they are telling means from 26 to 28 days. Okay, that is the interval. What is going to happen there? What is the hormonal changes there? Will the estrogen and progesterone will be increased or decreased? That is the question here. Obviously the answer will be progesterone and estrogen will be decreased there. Okay, is there anything? Come on, are you all with the track? Coming on to the key timings, some of the important timings you have to note from the LH surge to ovulation. LH surge to ovulation. LH surge will begin 12 hours before, 2 days before, that is 12 to 24 hours before ovulation. We can say 12 days at 12th day, 12 to 14 days. Okay, so LH surge to ovulation, it is 32 to 36 hours. So what is the peak to ovulation? LH peak after LH surge is going to happen, then it is 10 to 12 hours. Coming on to the hormonal regulation. Already I have told you the regulatory system, what are the hormonal changes is going to happen in that phase already. Yes. Coming on to this gonadotropin releasing hormone. This hypothalamus is releasing that. It stimulates the pituitary to release of FSH and LH. Already I have told follicular stimulating hormone and luteinizing hormone is responsible for the release. This hormone is responsible, that is GnRH. This follicular stimulating hormone again from the anterior pituitary, it stimulates the follicle growth. Follicular proliferation is going to happen, which is going to develop as the dominant follicle. Okay, again happening ovulation and formation of the corpus luteum, and corpus luteum will produce which hormone? Corpus luteum will produce which hormone? You can tell corpus luteum, corpus luteum will produce progesterone. Okay, coming on to this estrogen again. These are produced by granulosa cells. So already I have told you with this diagram, this is the oocyte, this is the granulosa cells, this is the theca cells. Estrogen is produced from this granulosa cells where the endometrial proliferation will be happening. Both this estrogen is having both positive and negative feedback. Okay, coming on to this progesterone. It is produced by obviously corpus luteum, secretory transformation of the endometrium. Okay, yes. Coming on to this inhibin and anti-Mullerian hormone, which is responsible for the ovulatory things, whether the ovulation is happening properly or not. This, with this help of this anti-Mullerian hormone, we can able to predict. Okay, this inhibin B also produced by these granulosa cells having a negative feedback on FSH. Which hormone is having a negative feedback on this normally secreting menstrual cycle? Which hormone they will be asking? The answer will be follicular stimulating hormone. Okay, that is inhibin hormone will have the negative feedback towards follicular stimulating hormone. That is the answer here. Okay, yes, come on, yes, good. Coming on to this corpus luteum. Corpus luteum is maintained by LH and also human chorionic. If the woman is having infertility complaints, they cannot able to conceive, we have to check the progesterone level. Okay, which day? That is day 22 we have to check for progesterone level. we have to check for the progesterone. Okay, what is the maximum progesterone? Will be at day 22. Yes. Coming on to the physiological highlights. Already I have told middle MERS is the mid-cycle abdomen pain at ovulation. Pain during the menstruation period, menstrual cycle. So mid-cycle abdomen pain the woman will be having. Okay. Estrogen feedback. Having a negative feedback normally and a positive feedback before LH surge. Okay, that is having the estrogen feedback. Coming on to the progesterone feedback, high levels inhibit the LH and FSH. Okay, these two hormones are very important, that is estrogen and progesterone. Will having a negative and positive feedbacks. Having a negative feedback normally, but positive feedbacks before LH surge. This progesterone having a negative feedback towards inhibition of this LH and FSH. Okay, yes. Till now we have discussed about the normal physiology. Now we are going to discuss about the MCQs and I will summarize the topic. Okay, is it clear? Yes. In a regular 28-day cycle, ovulation most commonly occurs in which of the following days? From day 7 to day 8, from day 10 to day 11, from day 14, from day 21. Come on. In a regular 28-day cycle, ovulation most commonly occurs which of the following days? C, yes. From the day 14, come on, I will be explaining from day 1 to day 28. Mid cycle is day 14. That is pre-ovulatory phase. This is post-ovulation phase. Okay, in this what is happening? Follicles are developed, follicular, and menstruation is happening. Menstruation also happening, follicular phase and proliferation. In that what is happening? Luteal phase and secretory phase. Which hormone plays a vital role here? Luteinizing hormone, FSH hormone, estrogen. From this, corpus luteum will develop progesterone. Estrogen under FSH stimulation. Theca interna cells, granulosa cells, lutein cells, oogonia. Come on. Shraddha, Mattavalam, Niharika, you're all right? Yes, I hope I have made something to understand this concept. Yes. Come on. So that I have increased this MCQ today for you all people. Last week we have asked to discuss more MCQs. I have taken beautiful MCQs for. So after that, this granulosa cells binds with this FSH, produce aromatase and convert this and this androstenedione. So after that, this granulosa cells, that is the inner layer. This is the, come on, this is oocyte, this is granulosa cells, this is theca cells. This granulosa cells again with the help of this follicular stimulating hormone will produce aromatase. This aromatase will convert this androgen to estrogen. That is 17 beta estradiol. Yes. So which is the answer now? Yes. B is the answer. You should not do the mistake again. So I have cleared the concept now. Is it? You can understand now? Yes. Is it clear? Yes. B. Nehi, Niharika. Good, good, good. Yes. After ovulation, the corpus luteum is primarily maintained by, after ovulation, corpus luteum is primarily maintained by estrogen alone, LH alone in non-pregnant state, follicular stimulating alone in non-pregnant state, inhibin in pregnant state. Come on. Yes. Corpus luteum produces progesterone, already known. After ovulation, corpus luteum is formed. By this, luteinizing hormone receptor also formed. Receptors. So LH always maintains, LH alone in pregnant, non-pregnant state it will be maintaining. Okay. Yes. Is it clear? So what about this estrogen alone? Estrogen alone cannot maintain the corpus luteum, and inhibin will be having a negative feedback. Negative feedback event immediately preceding ovulation. Immediately preceding ovulation. Surge of FSH and LH, the rise in the progesterone level, surge of estrogen level, surge of FSH. Common hormonal event immediately preceding ovulation. What is exactly happening in ovulation? Preceding, not after. The term is preceding. Preceding after ovulation is different. Preceding ovulation they are asking. So now you tell. C. The answer will be surge of FSH and LH. Let me discuss you with this. In ovulation, answer here. Coming on to the question. Okay. Surge of FSH and LH is happening there. That's the question. First, you make that preceding ovulation. They are asking preceding of ovulation. So obviously surge of FSH and LH. Okay. Yes. Which is not a function of estrogen during the follicular phase. I forgot to ask the question. LH peak how many times, and FSH and LH surge will be at from which days? From 12 to 14 days we can say. LH peak will be 10 to 12 hours. Okay, LH peak will be 10 to 12 hours. Is it clear? Yes. Which is not the function of estrogen during the follicular phase. During the follicular phase. Proliferation of endometrium, thinning of the cervical mucus, positive feedback on LH release before ovulation, increasing basal body temperature. Which is not the function of estrogen during follicular phase. Come on. Positive feedback on LH release before ovulation. Why? B. Thinning of the cervical mucus. So now again you are going to see D. Yes, Negi, you are correct. Yes, estrogen having, see, first you have to see the question first, read the question properly. Which is not a function of estrogen during the follicular phase. What is the follicular phase? You have to think 1 to 14 days. What is going to happen there? Follicles are going to develop. The dominant follicle is going to rupture, and it is going to release, egg is going to release for the ovulation. That is going to happen in follicular phase. follicular development and proliferation is happening there. Okay, that's what the follicular phase suggested. So obviously proliferation is going to happen there. The endometrial layer is going to get thick. Okay, cervical mucus is going to thin. Why? It sheds, it helps for the sperm motility. Okay, hospitalable for the sperm motility, the thinning of the cervical mucus is going to happen there. Okay, that is also one of the function of estrogen. And positive feedback on LH release before ovulation. This is also one of the important function of estrogen. The LH surge is happening, right? Without this estrogen, how the LH surge and LH will be peak? During ovulation, LH peak is also happening, estrogen peak also happening, FSH surge is also happening. Okay, so obviously there is no effect on basal body temperature. Basal body temperature is triggered only by this FSH and LH. Will act on this hypothalamus, mid of the cycle, the woman body temperature will be increased 0.5 degree Celsius, that is 1 degree Fahrenheit. 1 Fahrenheit can be increased, 0.5 degree Celsius or 1 Fahrenheit it will be increased. So answer will be D. Yes. Is it clear for you all? The concept is clear? Yes. What is the normal duration of luteal phase in the menstrual cycle? Luteal phase. Don't be confused here. Luteal phase. So what is the ovulation day? Ovulation day is day 14. So remaining 28 days is the normal cycle. So ovulation obviously occurs at day 14. So luteal phase, after that it is luteal phase only. So remaining days are it is 14 days are there. So obviously the answer will be C, 14 to 16 days. Yes, you are right. 12 to 14 days will be there, or 14 to 16 days will be there, or 10 to 12 days. Yeah. So 14 days is constant. It is a fixed days, that is 16 days. Luteal phase is fixed. Luteal phase is fixed, that is 14 to 16 days. When that the LH surge was happening, LH peak at which hour, how many hours LH peak? That is 10 to 12 hours. How to choose one? That is 16 days. If there is no interval, they are asking 14. Consider same question. You are having the options like 10 days, 12 days, C that is 14 days, D that is 16 days. Then you can choose the option 16. It is a fixed one, luteal phase. Okay? Yes, yes, correct, yes, correct, yes. Now, which of the following hormone reaches peak level just before ovulation? Now you are going to answer. Progesterone, LH, FSH, inhibin B. Come on. Yes, LH. Only LH will be peak. If estrogen is there, it will also peak. Okay? Remember that. So during follicular phase, the primary hormone secreted by the dominant follicle, The primary hormone secreted by the dominant follicle. They are asking. Already I have told follicular phase. The primary hormone secreted by the dominant follicle. Which hormone? Easy question, right? Yes, Negi, Basu, you are correct. That is estrogen. Corpus luteum only secretes progesterone. Okay, yes. Okay. Come on. Which of the following best describes the menstrual cycle hormonal pattern just prior to menstruation? Come on. Rapid increase in estrogen and progesterone, rapid decrease in estrogen and progesterone, rapid increase in luteinizing hormone and follicular stimulating hormone, or rising in HCG and progesterone. Come on. Menstrual cycle hormonal pattern just before to menstruation they are asking. See, now you are making a mistake here. See, first read the question properly. So, which of the following or best describe the menstrual cycle hormonal pattern just prior to menstruation? They are asking about the menstrual phase, where the endometrial layer sheds. It's a very simple question, but we are all making mistakes, right? Increase in LH and FSH is happening. Is happening there. Luteinizing hormone and LH hormone is increasing in this phase. That is ischemic phase. Premenstrual phase. Premenstrual phase they are asking. The question is premenstrual phase. Premenstrual phase, the question is, what hormone is going to play a vital role? During 26 to 28 days, this estrogen and progesterone going to shed. It is going to decrease. Okay. So there will be a rapid decrease in estrogen and progesterone. Okay. Yes, correct. Yes. Is it clear for you all now? During this pre-menstrual phase, that is ischemic phase, already I have told you no. Pre-ischemic phase, that is 26 to 28, the corpus luteum regress in no pregnancy. If no pregnancy is there, it going to regress itself, and endometrial necrosis, spiral arteries are going to shed there. Spasm is there, and progesterone and estrogen will be decreased. The endometrial shedding about to begin. Before that is happening, what is happening here? This secretory phase, progesterone and estrogen, always this FSH and LH also will be low. Okay. After the ovulation, already it's going, there is no role by this. Only estrogen and progesterone will be having a role there. Okay. Yes. Okay. Coming on to the reason and assertion question. Okay. Ovulation occurs approximately on day 14 of a regular 28-day cycle. Regular 28-day cycle. Come on. And the LH surge is triggered by sustained high estrogen level produced by the dominant follicle. Both A and R are correct. R is the correct explanation of A. Both A and R are true, but R is not the correct explanation of A. Assertion is true, but reason is false. Assertion is false, reason is true. Come on. Ovulation occurs approximately on day 14. Yes, correct. On a regular 28-day cycle. LH surge is triggered by the sustained high estrogen level produced by the dominant follicle. Are you agreeing with my point? Yes. Both are correct. Yes, this is LH surge is triggered by the estrogen level. High estrogen level, LH surge is triggered and LH peak is happening there. So that from the dominant follicle it is secreted. Okay, okay. The answer will be A. Both assertion and reason are correct. R is the correct explanation of this A. Yes. Again, now progesterone is the dominant hormone during secretory, that is luteal phase. Okay. Progesterone is secreted by the granulosa cells of the developing follicle. Come on, tell me. Progesterone is a dominant hormone during the luteal phase. Yes, I am agreeing. Progesterone is secreted by the granulosa cells of the developing follicle. Is it correct? Estrogen, if estrogen is high, LH surge is triggered. Okay, during the ovulation period. Progesterone is secreted by the granulosa cells of the developing follicle. Come on. A? How A? Can anyone explain how A is there? Progesterone is secreted by the granulosa cells of the developing follicle. Come on. Priya, you are correct. That is from corpus luteum. Already I have told, from corpus luteum progesterone is secreted. Not from the developed follicle. Already developed follicle. Right? Yes. The luteal phase. Assertion is the luteal phase of the menstrual cycle is fixed approximately 14 days. What is the reason? The lifespan of the corpus luteum is not prolonged without HCG support. Both A and R are true, and R is the correct explanation of A. Both A and R are true, but R is not the correct explanation of A. The luteal phase of menstrual cycle is fixed approximately 14 days. The lifespan of corpus luteum is not prolonged without HCG. Come on. Yes. For the luteal phase it is 16 days fixed. Okay, already we have discussed where it is. Yes, corpus luteum will be 12 to 16 days. Average we can take 14 days. Average we can say 14 days. Ovulation timing 14 days prior to the next day. But 12 to 16, the interval, fixed time is 16, but average we can say 14. Okay. Now we are going to this question. Okay, 14 days. Luteal phase approximately 14 days. The lifespan of corpus luteum is not prolonged without HCG support. Yes, it is correct. But if 16 days is there, we can go for the option. So A is false, and but the reason is true. Okay. Yes. Yes, correct. So what is the normal blood loss in the menstrual cycle for a normal woman? Come on, tell me. D. D. Stinisha, yes, come on, Priya, you are correct, you are correct, you are all correct, yes. It is 50 to 80 ml. So, current update, that is a new update, is 5 to 80 ml is also correct. Okay, 5 to 80 ml is also correct. So SATA questions, select all that apply questions is more you can expect. For basic topics also they can able to ask, so that I have came up with you questions. So which of the following are correct about the follicular phase of the menstrual cycle? Okay, select all that apply. Now you are going to tell the answer. Dominated by estrogen secretion, hence with the LH surge, progesterone is at peak, corresponds to the proliferative phase of the endometrium. FSH decreases towards end of this phase. Come on. What are the hormones? So what are the questions? Follicular phase, what is going to happen? That's what you are going to answer. 5 or 50? 5 to 80 ml, that is the new update. Not 50, okay. 50 to 80 ml we can say, okay. 5 to 80 ml is the new update. Yes. Come on to the next question. You are going to answer. SATA questions, it may look like very easy, but you should use your critical thinking there. Okay. Follicular phase, what is going to happen? Okay. Follicular phase, the day is 1 to 14. 1 to 14th day. So dominated by estrogen secretion. Is it correct or not? Yes. Yes, I am ticking yes. So ends with the LH surge. LH surge is happening at the pre-ovulatory phase also. So LH peak is also going to happen. So yes, I am going to tick this also. Progesterone is at peak. Are you agreeing? No. Corresponds to the proliferative phase of the endometrium. Is it correct? Follicles followed by the proliferation. Yes, I am agreeing with the point. FSH decreases towards the end of this phase. FSH is going to decrease. Yes. If FSH is high, then again another follicle is going to develop. Okay. From this follicle, see, consider this as a follicle. Okay. Okay. From this, only one dominant follicle is going to develop. Okay. With the help of LH, that is luteinizing hormone, and FSH. Only one dominant follicle is going to develop. So estrogen is secreted, dominant follicle ruptured, and the egg is released. If again this FSH and LH is going to be in peak, obviously another follicle is going to develop. So that is not the normal physiology here. So this estrogen having a negative feedback in decreasing this LH and FSH, so that from this other follicles which is underdeveloped follicle will form corpus luteum here, where progesterone is developed. Okay. From this corpus luteum is formed. This corpus luteum will secrete the progesterone. Is it clear? Yes. Now your concept is clear, I think so. Again I will repeat for some of the students, because this is very important, very important. Okay, I will again discuss this topic easily for you all people. Yes, because from this questions will come, so that I am stressing this. Consider this as the follicles. Okay, the oocyte is there. Okay, these are underdeveloped follicle. From this, only one dominant follicle is going to develop. Okay, with the help of FSH and LH. This granulosa cell, T cells, again going to form this estrogen. Okay, estrogen is developed from this LH and FSH. This estrogen is formed. It is increased now. At the ovulation time, the egg is released. The egg is released. Obviously, this estrogen, with the help of estrogen only, the follicle is released. This estrogen will have a negative feedback toward this LH and FSH to the hypothalamus. Again, this FSH and LH will be decreased. So that only with the help of this estrogen, again this follicles, underdeveloped follicle will form corpus luteum in the luteal phase. Okay. Okay, thank you so much, thank you. This corpus luteum will produce progesterone. This now estrogen and progesterone will having this secretory phase. It waits for the fertilization. If doesn't happen, again it is going to have the negative feedback to the hypothalamus, so that endometrial layer sheds, spiral arteries also spasm. It is menstrual cycle is happening. So that the options are dominated by the estrogen secretion. Yes, I am agreeing with the point. Hence with the LH surge, yes, LH peak will be 10 to 12 hours. Again, I am stressing this point. So C will not be there. Progesterone will be developed only after the follicular phase. After the ovulation, progesterone takes the role. Okay. Yes. Progesterone suppress LH production, estrogen agent suppress FSH production. Yes, correct. You are right. Yes. Let me see you the follicular estrogen driven ends with LH surge. Progesterone is low. Corresponds to the proliferative endometrium, and FSH drops as estrogen exerts the negative feedback. Due to this estrogen negative feedback, this FSH and LH will be reduced, so that the corpus luteum is formed, so that the progesterone is produced. Yes, correct. Okay, coming on to the next question. Which of the following are true about the corpus luteum? Corpus luteum, already I have told you lot of times. Again, if you want, I will also tell, because I need clarity. The students who are attending, they should have some clarity. After this class, you are not going to study menstrual cycle. From any question comes, you are going to answer. Okay? Yes, that's what I needed. So develops after ovulation under LH simulation. Are you agreeing with the point? Let me tell the commands. Produces estrogen and progesterone. Are you agreeing? Requires HCG to continue progesterone production in early pregnancy. Degenerates within 7 days if pregnancy does not occur. Converts into corpus albicans if not rescued by HCG. Yes, come on. I need the answer. A, B, C, D, E. Come on. It develops after the ovulation under LH simulation. Yes, I am agreeing. Produces estrogen progesterone. Yes. Here comes the confusion, whether I can click C or D or E. Consider if SATA question comes, if you are very confident. See, if the concept is clear, you will be confident. So some sort of confusion will be there, so that only the SATA questions they are giving to consume your time. Like clinical scenario based questions, this SATA questions will consume lot of time, because all the options will be similar. You will be confused with which option I am going to choose. If either you have missed one thing, the question will be wrong. You will be having negative marking. Better if you know the question, maximum 5 questions they may put. If you are in SATA questions, select all that update questions. 5 questions. Try to attend 2. That is more than enough. The 3 questions, if the concepts are clear, you can attend, or else leave the question. Or else remaining 3 questions, you just leave. That will be very helpful, because if you are attending that 5 questions, you may be knowing that for myocardial infections, we are following that ONAM. That is, first we are doing oxygenation, aspirins, morphine we are going to give, and this loading doses we are going to give. You all know aspirin we are going to give. So if there any other confusion regarding that scenario, you just leave the question. That is enough. If you confidently are knowing that, just attempt. Okay. First I am going with the A, B, D. Come on. Any other? Yes. Requires HCG is also correct, and degenerates within 7 days. In which time it will be regenerates? Degeneration happens within 7 days. The total is 28 days. Ovulation take place as 14 days. Which time it degenerates? After 7 days or plus 7 days. At the last 7 days, from 26 or 24 to 28, we can say it will get degenerates. So this is not the answer. It degenerates not within 7 days. Okay, if the pregnancy is not occurred, another 7 days is ovulation happening at 4 days, 14th day, again another 7 to 8 days, 7 to 9 days are there. Okay, so let me discuss you one contraceptive question to you all people. If the couple come to OPD asking which is the safe time to have the sexual intercourse, do not I am not able to conceive, I am not going to conceive now, which is the safe time to have the sexual intercourse, they are asking. What is your counseling you are going to give as a nurse? As a nurse, come on, tell me. It's a repeated question where you can expect. It's a repeated question, it's a common question. If the couple is a new couple, they are not going to want a baby, okay, they are asking a counseling question, at which time I can have the sexual intercourse. Come on, tell me. It is, come on, tell me, a woman can have at which time duration? That is the most important thing. First 7 days after menstruation and before 7 days of menstruation. Okay, so what is the normal menstruation days? 1 to 5 days. So after 5th day till day 12. So 6, 7, 8, 9, 10, 11, 12. 7 days. First and last 7 days. Day 12, they can have physical relationship so that they will not be pregnant. So last again after the ovulation, 14th day the ovulation is started. So till that the endometrial layer will be thick and the estrogen progesterone hormone will be high. Okay, for next 7 days no. So after 22 to 28 days, 22, 23, 24, 25, 26, 27, 28. From 22 to 28 they can have relationship. Okay, physical thing. Intercourse. So this is one important contraceptive question they can ask. Very simple, but we will be making mistake. From menstrual cycle, these questions may be understandable, I think so. Yes, thank you. Niharika, you are correct. So this is a very common counseling question asked by for the nurses. Okay, come on. Now identify the hormones that exert at a negative feedback effect on the anterior pituitary during the luteal phase. Luteal phase. This is the keyword. And negative feedback. During luteal phase 14 days is crossed. 14 days is crossed. Now tell me. Yes. Come on, tell me. So I will not going to be answered here. So if there is any delay also, I will wait, because you need to understand this concept. This is base for everything. If you are going to learn pregnancy, if you are going to learn abnormal uterine bleeding, then you are going to learn menopause. This is the basic for everything. You have to know the normal physiology. For that only I am stressing it now. Again, I will summarize the points so that you can able to understand the concept clearly. Okay, come on. The negative feedback they are asking, luteal phase. In the luteal phase, what is going to which are the hormones to be reduced? Okay, in luteal phase. Come on. LH will be there or FSH will be there. Select all that, apply. Come on. Okay, come on. Whether hinebin will be having a negative feedback in the luteal phase. Hinebin. LH will be having a negative feedback. No. Estrogen will be having negative feedback. Progesterone will be having negative feedback. Hinebin will be having negative feedback. This two hormone will not have a negative feedback. Is it correct? Is it correct? Come on, think. In luteal phase, this estrogen is high. Progesterone also will be high. Which hormones will be low? This also will be low. Only this estrogen and progesterone will be having a negative feedback to reduce this hormone. Consider if in luteal phase, this estrogen will be having a negative feedback, and also this inhibin. Inhibin also having a negative feedback in the hypothalamus to decrease this LH and FSH. Okay, yes. Coming on to the next question. Which are the changes seen in secretory luteal phase in the endometrium? Select all that, apply. Now, it is also a very easy question. In luteal phase, what is happening in the endometrial layer? They are asking. In the endometrium, what is going to happen? Okay, yes. The glands become tortuous and coiled. Endometrial thickness decreases. Secretions become rich in glycogen. Spiral arteries elongated and coil. Endometrial proliferation is driven by estrogen alone. In luteal phase they are asking. In luteal phase what is happening? Yes, come on. In luteal phase, endometrial layer is going to thick or thin. The glands become tortuous and coiled, yes. Secretions become rich in glycogen. Spiral arteries elongate and coil. Endometrial proliferation is driven by the estrogen alone. Yes, B, C, D. ABD, everyone is telling. Okay. So in luteal phase, the endometrial layer is going to be get thick, and spiral arteries also going to be there. After luteal phase, secretory phase also is there. So now the glands become tortuous and coiled. Yes. Okay. The endometrial thickness is going to decrease. After luteal phase, it is going to decrease. As of now, it is thick only. Okay. Secretions become rich in glycogen. Yes. Okay. And spiral arteries elongated and coil. It is going to happen. Yes. B, C, D. Yes. We can say B, C and D. It is not working. endometrial layer thickness going to be decreased and secretions are going to be rich in glycogen and spiral arteries elongated and coiled. Endometrial proliferation is driven by estrogen alone. Are you agreeing with this point? Yes, it is tricky. Sure, that's what I am telling. If 5 questions they have asked, you just attend 2 questions, that will be very easy. It will be very time consuming. If you are having enough time, then you can learn properly and understand the questions and read the options properly and give the answer. If any one mistake, one of the thing, if you have not selected, first I have selected A also. If you have not selected anything, any one also, it will be a negative marking. Okay, yes. Okay, till now I have discussed some important things. Let me summarize quickly within 5 minutes and I will winding up the session. Okay. Okay. With this point, we are going to discuss and summarize everything. Okay. Consider this. Okay. Okay. 1, 2 happens at 14th day. Okay. It is the first day. This is day 28 here. Okay. What is exactly happening? From the hypothalamus, GnRH, gonadotropin releasing hormone, releases 3 hormones. Trigger of this hypothalamus. From the hypothalamus, it drives anterior pituitary. It drives 3 hormones: LH, FSH, and inhibin. Okay, is it clear? Then low estrogen at the end of the menses. Obviously, this first 5 days will be having menstrual phase, shedding of menstruation, menstrual blood, endometrial layer thickness sheds, and it's going to be washing. The blood flow has started. Proliferative phase, thickness is going to happen. Yes, next Wednesday we are going to meet. Don't worry. Let me give me the topics also. Let me summarize the point quickly. Again, the menstrual changes is going to happen. This is a simple concept. Hope you all doing. This is the simple concept. Hope you all understanding the concept clearly. I hope. Is it clear for you all? And these are the pituitary and hormone change, hypothalamus and pituitary gland changes. Hormone is FS and LSH. What are the ovarian uterine hormones? That is estrogen and progesterone. Ovarian hormones. Okay, this may be your question also. What are the ovarian hormones which is responsible for the menstruation? Simply you will be kicking FSH and LH. And you will be having negative marking. So that is not the thing. Ovarian hormones is estrogen and progesterone. Pituitary hormones is LH and FSH. Okay. Yes. Definitely there are chances to ask SATA questions. Hope from ESIC also. I have appeared for the ESIC. Okay. In that they have asked this SATA questions. Okay. There is lot of chances. Hope you should be very confident that this type of questions also will be coming. But the only thing is SATA questions are time consuming. It is very time consuming for you all people. So that keep a separate time for that during the exam period. So now onwards you just try to practice this question, so that I have came up with this SATA questions also. Okay. Yes. Pituitary hormones is LH and FSH. Ovarian hormones is estrogen and progesterone. Okay. Yes. Is that clear now? Yes. Yes, sorry, just a minute. Yes. So that for every scientific content you can also follow my Instagram page, that is Nurse Prep with Muthu. So hope you all doing good, prepare well, be confident, practice MCQs daily so that it will improve yourself. Okay, love you all, see you soon next week. Okay, thank you all.